Hello and good morning, good afternoon, everyone. My name is Jennifer Thomas and I'm Managing Director of Plug and Play Health. And we're so pleased to have you join us today for another of our Plug and Play Health webinar series. This one is Advancing Healthcare with Digital Therapeutics. And it's one of our many webinars across our industries. It allows us to take advantage of our content and information that we have from our corporate and startup networks and share it more broadly so that despite all this remote work, which seems like it will end sometime this summer, we can continue to engage with you and learn from one another. So thanks again for joining us. For those of you who are not familiar with Plug and Play, just a little overview. Plug and Play is headquartered in Silicon Valley. What we do across the company is to connect the world's best startups with national and corporate partners to help them bring technology and innovation to market faster. And we do this in almost every industry worldwide. When it comes to healthcare, we're specifically addressing the need to improve the patient experience, the need to improve patient outcomes, and improve provider experiences as well. So today, we're going to talk about digital therapeutics. It's definitely a buzzword, and it's been in the news so that the likes of SoftBank and Optum have been plowing 100 million or 75 million respectively into startups working on digital therapeutics. In addition, the FDA cleared the first ever prescription digital video game last June to treat ADHD, and then in December cleared a mobile sleep app to treat nightmares. So like many areas of healthcare, COVID-19 sort of advanced and illustrated the need for different treatment options which gave rise to digital therapeutics. But consumers are also driving this trend, and they're demanding new care as the shift goes from the doctor's office to the home. So we're going to talk about all of that today and how digital therapeutics is not just digital health, but there's a deeper meaning to the terminology. So with that, let's get to the program and the agenda today. We have an excellent program. The first half will be a panel discussion with Dr. Neil Mills. He's Chief Medical Officer of Aon's Health and Benefits Practice, and Bobby Uyama, who's Senior Director of Frontier Business at Sumitomo Dynapon Pharma America. Then you'll hear from 4 startups working in the digital therapeutic space: Nutrix, D-Stroke, Cognivive, and Second Nature. As always, please be ready for Q&A. Because your engagement makes it more fun and interesting for the panelists and the startups.